Asthma and respiratory disorders. Asthma and respiratory disorders are conditions that affect the respiratory system, which includes the organs and tissues involved in breathing and gas exchange. These disorders can range from mild and manageable conditions to more severe and life-threatening illnesses. Let's explore asthma and some other common respiratory disorders. Asthma. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, which leads to symptoms like wheezing, coughing, shortness of breath, and chest tightness. These symptoms can range from mild to severe and are often triggered by factors such as allergens, exercise, cold air, and respiratory infections. Asthma is usually managed with a combination of long-term control medications to reduce inflammation and quick relief medications to relieve acute symptoms. Chronic obstructive pulmonary disease, COPD. COPD is a progressive lung disease that encompasses conditions like chronic bronchitis and emphysema. It is primarily caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. COPD leads to a gradual loss of lung function, resulting in symptoms like cough, excessive mucus production, shortness of breath, and reduced exercise tolerance. There is no cure for COPD, but treatments can help manage symptoms and slow disease progression. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. It can be caused by bacteria, viruses, or fungi. Symptoms include fever, chills, cough, chest pain, and difficulty breathing. Pneumonia can vary in severity, with mild cases often treated with rest and antibiotics, while severe cases may require hospitalization and more intensive treatment. Interstitial lung disease, ILD. ILD refers to a group of disorders characterized by inflammation and scarring, fibrosis, of the lung tissue between the air sacs. This can lead to reduced lung function and difficulty in breathing. Causes of ILD can include exposure to environmental toxins, certain medications, and autoimmune diseases. Treatment varies depending on the specific type of ILD and its underlying cause. Bronchiectasis. Bronchiectasis is a condition in which the airways in the lungs become damaged and widened, leading to a buildup of mucus that can increase the risk of infections. Common symptoms include chronic cough, excessive mucus production, and recurrent respiratory infections. Treatment involves clearing mucus, managing infections, and addressing underlying causes. Lung cancer. Lung cancer is a malignant growth of cells in the lungs. It is often associated with smoking, but it can also occur in non-smokers due to other factors like exposure to secondhand smoke, environmental toxins, and genetic predisposition. Symptoms may include persistent cough, chest pain, weight loss, and difficulty breathing. Treatment options include surgery, chemotherapy, radiation therapy, targeted therapies, and immunotherapy. These are just a few examples of respiratory disorders. It's important to note that early diagnosis, proper medical management, lifestyle changes, and avoiding risk factors are crucial for maintaining respiratory health. If you or someone you know is experiencing respiratory symptoms, it's recommended to seek medical advice for accurate diagnosis and appropriate treatment.
Like, share, subscribe. Thanks for watching.